Welcome to the Field Dynamics podcast. We're here to facilitate inspiring dialogues about the nature of consciousness across disciplines, communities, and practitioners, all with a holistic perspective.
From energy healing to somatic therapies, from neuroscience to meditation, we believe the most interesting things happen at the boundaries of disciplines.
I'm Christabel.
And I'm Keith.
Thanks for joining us today and enjoy the episode. Hello and welcome to the Field Dynamics podcast. Today we have with us guest Peter Mall. Peter Mall is one of the UK's leading practitioners of acupuncture, the Dean at the College of Integrated Chinese Medicine in Reading, UK, and a founding member of the Executive Committee of the British Acupuncture Council. He is author of Acupuncture for Body, Mind and Spirit, directed at patients and prospective students, and co-author of the major textbook, 5-Element Constitutional Acupuncture. Peter has lectured extensively in Europe, Israel and the US. His particular interest lies in how Chinese medicine understands how people's internal worlds, especially their emotions, affect their physical and psychological health. Peter states that Western medicine is a great system, yet it lacks an understanding of how stress and distress affect people's health. However, this is one of Chinese medicine's greatest strengths. Peter received an MA in Modern History from Oxford University and has been practicing acupuncture since 1978. Welcome, Peter. A pleasure to have you here with us today. Thank you for taking the time.
It's a pleasure to be here.
Firstly, I'm wondering what it is you might share with people or say to people when they ask you, what can acupuncture do for me?
I think the key point there is what can it do for me? I think when people first come to acupuncture, they usually have a fairly specific problem they would like to see improve. That's not always the case, actually. Some people come because Chinese medicine has a very strong preventative ethos as well. So occasionally patients come without very much troubling them, really, but they still like to come and have acupuncture to maintain better well-being. But most patients, I suppose, come, they have an agenda, they have migraines, or they have asthma, or they have anxiety, or whatever it may be. And they would normally talk to me about whether acupuncture is an effective treatment for that particular condition. So I would normally answer it in those kind of terms. I once did a phone-in where people kept on asking me much the same question, just with a slightly different problem. Would it be any good for asthma? Would it be any good for migraines? Would it be any good for period pains? And I found myself saying the same thing over and over again, which was acupuncture would be perfectly appropriate for that particular problem. I'm trying to make the point that acupuncture is good for a huge range of problems, really. But people obviously still have their own particular situation that they would like to see addressed.
Thank you, Peter. You say in your book that Western medicine and Chinese medicine are fundamentally different in terms of their philosophical basis and approach. Could you extrapolate a little bit on this idea of the differences between a Chinese medicine perspective and a Western medical perspective?
Well, Chinese medicine, be it acupuncture or herbs or any of the forms of Chinese medicine at all, really, what lies at the very heart of Chinese medicine is the idea of qi. And if you grow up in certain countries in the world, the notion that living organisms all have qi within them is a perfectly natural thing to think. But when those of us who grew up in the West were not brought up with that mentality at all, really. So that's a very, very fundamental difference. And if you're occasionally people who are will kind of say, well, what is this qi and what it's all about? And I'm a bit. It's almost, if you don't grasp that concept, I think if you don't see that that's a possibility, I think it's very hard to convince somebody who's not brought up in that mentality, who maybe comes out of a very scientific background. It's very hard to convince them of that. But for those people, those of us who work with qi, it becomes a natural part of our lives, really.
So this word qi, you're saying we can't really go further with understanding the differences unless we understand what qi is. So let's talk a little bit about qi. I'm certainly familiar with the word. I know qigong, tai chi. Is qi something you could define? Is it related to prana from the yogic tradition? Is it elan vital? Is it, there are a lot of terms in traditional medicines that talk about this life force kind of thing. How do you define qi, and how can you help people to understand more of why it's so critical in Chinese medicine practice?
Well, I think I'm not an expert in this matter, but as my understanding, the differences between, for example, prana and qi are very, very slight, really. The concept of chakras, Chinese medicine doesn't quite think in those kind of ways, though actually it does at times, a little bit. But I think we're painfully talking about very much the same kind of life force that you're describing there. I think people perceive it slightly differently and perceive how best to influence that and work with that. If you're a yoga practitioner, you would be adopting asanas and various postures to attempt to bring about change in the person's prana. And an acupuncturist is working on the main channels of qi that run through the body. But there's an obvious problem that you can't cut open a body and see chakras, and you can't cut open a body and see acupuncture points. Although for the first time in history, there are now electronic machines that can, I'm not sure what they measure exactly, but will show up where acupuncture points are. It's there in terms of what you might loosely call electrical energy, but there's no anatomical structures that you can cut open a body and see. So if you're brought up, one of my best friends, is a doctor. He grew up dissecting bodies and looking at anatomy. And if you look at anatomy, then you can't see the acupuncture points, and you can't see the chakras. And there's all sorts of things that are not visible to the human eye, but it doesn't mean they don't exist.
That brings me, Peter, a little bit to the idea of what we might refer to at Field Dynamics as sensing, and the capacity to sense or feel the movement and the experience of qi through the body. And I wondered what your experience is as a practitioner. You mentioned a couple of key words there, electricity and measurements, and we have this idea concept around the idea of electricity and electromagnetism being perhaps related to the concept of qi. What's your experience as a practitioner as you're needling points or working with these meridians, and you're feeling, are you feeling and sensing a release of qi through the system? How does that show itself to you?
Yes, that's a good question, actually. I think one of the things that first strikes patients when they come to me for acupuncture is that the acupuncture points are very tiny. And my style really is I'm quite minimalistic in the sense that I don't like to do very many points, but I do like to hit them dead on as much as I possibly can, whereas some practitioners are inclined to put in lots of needles and be possibly a little bit more haphazard in terms of the accuracy of their point location. So I remember when I was still a young practitioner, the first doctor I ever took on, I was a little bit nervous, thinking, "Oh, a doctor, right?" I was still new in practice. But what struck him first of all was that when I missed the point, he could feel nothing at all. But when I hit the point, he had the sensation which the Chinese call de qi, which is hard to describe, but certainly is at times a fairly intense sensation, only at times. And so that from the patient's point of view, when I hit the point, they can tell whether I hit the point or not, because if I don't hit the point, they don't feel anything. Well, they can feel that I'm maybe putting a needle in, but it's a very fine needle, so they barely feel that. But when I hit the point, they get quite a strong sensation. And as the years have gone by, see, I've been in practice, for nearly 45 years now. But after about 20, 25 years, I started to think, I think I can feel when I'm hitting the point. But it took me a very, very long time before I started to kind of really trust that. And now, as time has gone by, I'm now quite very adept, I think, really, at feeling through the needle when I've hit the qi of the patient or not. If I'm not quite what you might loosely call in the flow, if I'm just basically very tired or just not at my best in some way, I can sometimes lose that. I'm not so sure I've hit the points or not. But assuming that I'm basically in the flow and on good form, then I can feel the qi through the needle. And therefore, I don't need to ask the patient whether I've hit the points or not. I know whether I've hit the point or not. I rather wish someone had told me that maybe that would be possible. If someone had told me that would be possible, I might not have spent the first 20, 25 years not thinking about that at all, and only slowly starting to think, maybe I could feel something with the needle. Maybe if someone had told me that you should be able to feel something through the needle, I might have got there a bit quicker.
I'm particularly fascinated with the idea of whether there's any mirroring in your system as you see it when you're working on somebody, or if you're purely connecting to or using as a feedback loop the client's experience of things being felt.
I certainly have that direct experience. And it was striking to me at one stage that I was being treated by a practitioner who did not have very strong, was not very robust. Their chi was not very strong. She didn't have very good health, really. It was very striking to me that when she needled me, that I could barely feel the chi at all. Whereas when I've had other practitioners, I felt the chi much, much more strongly. So I'm not sure I fully understand it, but I think that there's some interchange here between the chi of the practitioner and the chi of the patient. And it certainly does seem as though certain practitioners are more capable of bringing about change in people's chi than other practitioners. And it's not just a technical issue here. It's not just a question of how good their point location is. There does seem to be some more intangible factors here that mean that certain practitioners can initiate more change in people's chi than other practitioners can. And possibly the practice of Qigong and Tai Chi may well enhance that quality, but I think it's also something a bit more inherent in the nature of the practitioner themselves.
Are you working intuitively in the moment with the placement of the needles, or are you perhaps using more predetermined points or patterns based on your knowledge of the client's intake? Or how is it that as you're working through a treatment, you're choosing how and where to locate those or place those needles?
Like all systems of medicine should be, I think, is a wonderful mixture of both what you might loosely call art and science, or intuition and rationality. There's certain diagnostic indications that you would look for in Chinese medicine. There are always patterns that you hope you're going to recognize so you can understand which functions have become dysfunctional. When you go and see any kind of physician, you don't want to be an interesting case. You want to be a really boring case. You want to have patterns that the practitioner can recognize, has seen many times before and knows how to address. So where the points lie were laid down in antiquity. And so when I'm choosing points, I'm certainly where the points are. That's a source of study to work out exactly where the points are. It's also a source of study to make accurate diagnosis. One needs to think clearly and make accurate diagnosis as well in terms of one's point selection. But also, medicine's also an art, not just a science. And so, many acupuncture practitioners would also be quite intuitive in the sense of there are certain aspects of the diagnosis which are based upon the content of what the patient says, or what the pulse diagnosis or what the tongue diagnosis may say. But also, many practitioners are quite intuitive of having a sense of the person's, the nature of the person's chi, and also particularly in Chinese medicine, the nature of the person's constitutional imbalance, which is partly diagnosed by the nature of the person's emotional world.
I want to just pick up for a moment. You were mentioning about getting more and more sensitive to chi moving, and it reminded me of there's a particular, I believe it's a Japanese art form of acupuncture that comes out of the blind community, in which they don't use needles, they just use their hands, right? And then even some prodding devices. But the whole point is they just feel chi stagnation directly through their senses, right? And this leads me to, this is just pure speculation. I'm curious, how do you think it is that this system was mapped and identified in the first place, given that it does seem a bit of a step for the modern human to imagine being able to identify so precisely the movement of chi in the body, all of these points, their interrelationships, their elemental transformations, etc. How do you think that was taking place a while ago? What factors might have contributed to being able to understand a system so subtle and complex?
I'm certainly not sure about that. I think that it's certainly very striking that some of the acupuncture points very often become tender upon palpation. And I don't think people started off, you didn't have stainless steel needles in those days. I think people started off with massage type techniques, massaging tender points, I think, in the body. And some quite sensitive patients can very commonly trace out the path of the channels through the body. Now, if you needle a particular acupuncture point, they'll often say, "Oh, it ran down my leg down here and just down here." So they can often detect where the channel runs. And I suspect that in primitive times, before that people had Netflix and all sorts of other distractions, they didn't have very much to do in the evenings themselves. I'm sure they spent much more time, both I think possibly in meditation, but also possibly massaging tender points on the body and seeing sensations where sensations would run down the channels. I think it probably started off in that kind of way. It's a very striking thing, though, that I think his name was Uzi or something like that. He was found in the Dolomites. I'm not sure exactly what time it was, but certainly long before they would think there'd be a link between China and anybody in Europe. And he had acupuncture points marked on his body, which they found when they found him in a glacier some time ago. And that was long before they thought there could be any consistent links between the Far East and anybody in Europe. So whether they were exploring the same kind of ideas, well, not ideas so much, some kind of practicalities in Europe in prehistoric times or very, very early times, anyway, possibly historic, I suppose, or whether there was more connection between the Far East, between China and Europe at that time than people would commonly think, is not entirely clear to me. But it's really rather striking that he should have acupuncture points marked on his body.
I'd love to bring things around a little bit more to your personal journey as a practitioner, as an individual, and to ask, what was it that initially attracted you personally to study acupuncture?
After I left university, I went to, these were the 70s, it was a long time ago. So I went and lived in India for a long time, for 15 months or so. And of course, if you live in India for a long period of time, and if you're short of money, the tendency is you get ill after a period of time. And so I rather predictably became ill. And so I saw a Tibetan doctor, I saw an Ayurvedic doctor, I saw a homeopath. Now, as it happens, it was Western medicine that got me better because I had parasites, and Western medicine and heavy antibiotics was what actually got me better. But I just became, I didn't know there were, back in the 70s, I didn't know there were any other kinds of systems of medicine apart from going to see your doctor, as one did. And certainly when I finished, when I thought the time had come to come back to the West from India, I thought I needed to come back and find myself some meaningful work. And I had no idea what that would be, but I knew enough to know I needed to be helping people. That much I'd worked out. If I was going to be happy in my work, I needed to be making some contribution. I needed to be helping other people. And then, like lots of things in life, it's partly a question of chance. I met someone who was studying acupuncture, and so I found this fantastic acupuncture teacher in Leamington Spa, which was of all funny places to find a fantastic acupuncture teacher. And so although I was kind of interested in different systems of medicine, it never really occurred to me that I might become a practitioner. Maybe it should have occurred to me, but it hadn't. And then when this person said, I found this terrific acupuncture teacher and you can train with him and become an acupuncturist, that kind of fitted into coming back to the West and what I thought might make a contribution. It might help other people. And so I went and met him, and he was a very charismatic person, really, my teacher, Worsley. I kind of thought, no, I think I found something that would be an appropriate work for me. And I've never looked back at all, even in my darkest moments, as it were. I've never seriously considered not being an acupuncturist. It's my life work, really.
How have you benefited from acupuncture? Do you receive treatments regularly? Was there something seminal in your experience of it initially that helped to foster your interest and progression through all of that training?
No, it's striking because I over the years I've done lots of interviewing of applicants for the college, and certainly most people come into acupuncture having been patients themselves, and I hadn't been a patient myself, so it didn't come through that route for me really. But soon after studying, I thought, well, I'd better try having treatment myself to see what this is about, as it were, because I am by nature quite a skeptical being, really. And there were certain aspects of Chinese medicine that I thought, this sounds a bit strange to me. I'm not sure I can quite get my head around this. So I thought I'd better have treatment myself, although I had no particular health problems by that time, actually. So yes, I certainly had the direct experience. They had the direct experience of feeling the qi when acupuncture points were needled. So it really came about that kind of way. I think some people come into acupuncture having through qigong and tai chi. I think they've been working with qi or something you might call qi, maybe coming out of yoga. And so they're interested, they come at it from that angle as opposed to having been a patient. But I really came at it from a different angle, really. I just had a kind of more intellectual curiosity about different styles of medicine. And then almost by chance, really, fell into one of them as opposed to one of the other ones, I think, really.
We touched on this a little bit at the beginning, Peter, with regards to people asking you, what acupuncture may or may not treat, what it might be suitable for. I wonder if there's a sort of a split or a division in people approaching you with regards to physical symptomology, physical issues, as opposed to emotional or psychological concerns or agendas. And I wonder if you talk a little bit more to the latter point and the potential usefulness of this work for emotional, more psychological issue-based work, principally, and your experience of that?
I think a lot of people in this country associate acupuncture with the treatment of musculoskeletal conditions. And certainly these days, lots of physiotherapists and osteopaths and chiropractors do basic courses in acupuncture and treat musculoskeletal conditions, and I'm sure very often quite effectively. If a patient comes to me with what you might loosely call a purely musculoskeletal condition, they've got tennis elbow or frozen shoulder, I'll do my level best, because physical pain and discomfort is so debilitating for a person's spirit that, of course, I'll do my level best to help them with that physical discomfort or pain. But that's not really my main interest in Chinese medicine. My main interest lies in the relationship between the person's internal world and how that affects their psychological state. And then, of course, they may well affect their physical health as well. People somatize their stress and distress all the time. And so many people would present with seemingly a physical problem, but my perception would very often be, and I think many physicians' perception would be, that the trouble is not purely physical, but lies in the relationship between their stress and distress, for want of a better way of putting it, and their somatizing that distress rather more than fully experiencing it in themselves, I think.
Yeah, you talk about this in your book around the connection between emotions and spirit and health. Could you speak a little about this word spirit in the context of Chinese medicine? What is meant by that, and how do emotions relate to spirit? And then ultimately, how is this externalized or manifest in one's health?
Well, it's kind of controversial term, I think. The word spirit itself, I think it's a very loaded term. It means very different things for different people. Sometimes you find for example, some evangelical Christians will decline to have acupuncture because of the use of the word spirit, whereas for them the word spirit is almost a quite technical sense in a Christian sense, and they think we mean that. We don't really mean that when we're talking about spirit in Chinese medicine terms. You know, Thackeray described one of his characters as being saddened and humbled in spirit, and it's the sense of the nature of the being, really, that we're talking about, really. One of the great translators from Chinese medicine, he described it as that what makes an individual unique. You know, there's never going to be another Peter Mole that's going to have exactly those characteristics and nature of their qi ever again in the world. I think what we're talking about here really is what makes a human being an individual. The Chinese are inclined to have a sense that, one might disagree with this about one's own particular pet, perhaps, but they're inclined to take the view that animals, they have what they call jing, which is the kind of genetic inheritance, really, and qi, but they don't have what they call shen. Shen being the kind of human spirit and human consciousness. They really talk about the spirit as what makes a human being, I think, really, and what gives us our individuality.
So is the equation then that when someone is not in touch with that individuality and not in touch with their spirit, so to speak, then the perturbation is through emotional unrest, and thereby their health warbles or wavers?
Yes, but you could put it the other way around as well. It's when their emotions become prolonged or intense that they become out of touch with their true nature and with their spirit. So, in Chinese medicine, the emotions are regarded really as being what are called the internal causes of disease. That it's when either through our genetic predisposition or through the emotional vagaries of our childhoods, particularly, that we become that the emotions no longer flow freely in the being, and that's what helps us to lose our true nature and to lose our individuality in a way, and lose our sense of self. So they're inclined to see it not so much that the person is not in touch with their spirit and therefore their emotions become distressed, so that's obviously possible. We're more inclined to focus on it the other way around, really. It's how the emotions that make us lose our individuality and our true nature in that way. Yes. The goal of treatment really is almost the best thing a person says to me, really, is that I feel back to my normal self. Because sometimes it's a bit hard to define what one's normal self is, but when you're not it. this is not how I should be. This is not me being true to myself and flourishing in myself. And so to help the person restore that kind of sense of themselves is, I'm a very happy man when patients say, oh, I feel back to my normal self again.
That's really interesting that you bring that phrase up. The very first episode we did with Gary Strauss, he specifically said the most common thing he hears when working on people, and he was mostly a craniosacral practitioner, and he says most common thing he hears people say is, I feel like myself. I feel like myself. I find that strikingly similar. So my question is, you work with a lot of people, you're teaching and treating a lot of people. What is the most common thing people are coming into? Like the modern human being, what is the most common emotional distress or chi imbalance they have? And does it express through a particular meridian or meridian pair?
Well, Chinese medicine talks about different emotions affecting different functions. But I have to say that I think what many of us would regard as very, very common is a syndrome called chi stagnation, which is partly focused on the liver. And what causes chi stagnation really very, very easily is feelings of frustration, feelings of constraint. Frustration, we're all, we may look at the news on television or whatever it may be, or in our own personal lives. But the feeling that life is not as we want it to be. The Buddha talked about, that the cause of suffering is desire. That's not a great translation, I think, really. And in a sense, we all desire life to be different to how it is. We desire maybe ourselves to be different to how we actually are. And I think that sense of disappointment and frustration about the external world or about how we are in ourselves, I think is, a key aspect of almost of the human condition, and certainly has its effect upon people's chi. There's very few adult patients. I don't treat small children anymore. My wife's a specialist in treats only children. But by the time I get to see a patient who's adult or at least adolescent or beyond, then these kind of pressures are bringing to bear upon their physical and or psychological health, I think. One of my colleagues, he once said that, I'm not sure I totally agree with this, but he once reckoned that fundamentally about a third of his patients were suffering from a broken heart. And I think that maybe a third's a little bit high, and of course it depends on how you define a broken heart. But I take his point. I think I see many people who their spirits have become diminished by sadness, by feelings of hurt, by feelings of rejection and feeling unloved and feelings of loneliness. I think they're also very, very common feeling states for people and have a profound effect upon their health.
That's a really emotive point, Peter. This idea, if we extend the definition of the broken heart, say, into the broken spirit, or the idea of dissatisfaction with external circumstance in life, and certainly a number of the people who are connecting in the community, field dynamics community, with Keith and myself, and other healing communities we've participated in different modalities, that does indeed seem to be a fundamental or common thread among people seeking to move away from suffering and away from their pain. Which brings me to this idea of outside of acupuncture, what is it that you, as your many years of experience as a practitioner, see as useful or promising ways of balancing and building health holistically and including that vital aspect of the Shen?
I think different people have different paths. I think people often ask me for advice in some shape or form about what would be best for them. And obviously for some people, I think, bringing some change to their diet would be a good thing, and maybe not drinking a bottle of wine a night might be a good thing for many people as well. So I think there's some fairly tangible advice you can give. But I think in terms of really nourishing a person's spirit, I think it's a very different path for very different people. I think for some people, doing qigong or yoga, I think is a great way forward. But I think that's not for everybody by any manner of means. The French philosopher Henri Amiel, he said that happiness is the basis of health. And I think that he's got a certain point there. But how a human being achieves happiness, whether that means that they then go out and start, I just think of a particular patient who was rather sad and lonely and brokenhearted. I was talking to her. Well, what would nourish you more in yourself? And she said to me, well, I've always rather fancied doing ballroom dancing, she said. Now, that wouldn't be everybody's path doing ballroom dancing. It certainly wouldn't be my path doing ballroom dancing, but that was what she wanted to do, So I encouraged her to go ballroom dancing, and in no time, she went to ballroom dancing, endlessly going there several evenings a week, had a whole new social circle, lots of friends. It was great for her happiness. I think it was the best thing she ever did, really, frankly. But I don't think going ballroom dancing would be everybody's path for nourishing their spirit. I think different people have to find their own individual path. What would be best for them, wouldn't they? Really,
Absolutely. And bringing it back to acupuncture as a practitioner, is a way in which you see a person best being supported by that healing form? So is it about coming in weekly, fortnightly, monthly in a preventative sense? Is it about touching base as and when issues arise? I mean, or is that, again, very varied person to person?
I think it's very, very person to person, really. I think that for some patients, I see them for a period of time, they get much better, and I never see them again. And there's other patients who perhaps have more long-standing chronic problems where it's appropriate, and I see them once every couple of months. Or there's a bit of tradition in China to see patients at the change of the seasons. So there are quite a lot of patients I see roughly at the change of the seasons. They keep pretty well in general. I'm happy to see them maybe 4 times a year, somewhere in that ballpark. There's other patients who I never see again, really. It's just returning to that previous topic about nourishing someone's spirit. I think sounds a bit mundane, but when Freud was asked, how do you avoid neurosis, Sigmund, or whatever the question was, he said work and love. Work and love. These are the two great poles, and I think that finding meaningful, fulfilling activity, we call it work, and that may be bringing up one's children or whatever that work may be, and loving relationships. I think that there's more to life than work and love, but I think these are two colossal planks in people's lives, finding meaningful work and loving relationships. And I think that those two are both very nourishing to the human spirit.
So to pivot from spirit to another major concept that seems to relate to one being in harmony or contentment, it would be the Tao. If we look at this paradigm of happiness, which is very much a modern idea, right? This idea of the pursuit of happiness. I wonder how that pairs with a more ancient, a more traditional, a more Eastern perspective on something like the Tao, and how that leads one to health and well-being. How would you compare happiness to the Tao?
I don't think they're the same thing. I think you're right that the pursuit of happiness has become is a slightly modern phenomenon, really. But I think living in harmony with nature, living with harmony with the nature of the time, I think that does lie very closely to the concept of the Tao. The Wu Wei is the Chinese term, which is often translated as non-action. And I think people think that means so you don't actually involve yourself, you don't act at all. But I think it much more closely means, meeting the needs of the situation. I think that one needs to assess in any particular situation and seeing what's the appropriate action in that particular situation. And I think through that comes fulfillment. I think that there's also a concept in Chinese philosophy about what they call the Ming. The human being should try and achieve one's destiny. It's a slightly vague concept, the notion of what one's destiny is. But I think people know when they're not fulfilling themselves. And I think that search for being in harmony with one's true nature and living one's life in accordance with one's values. I think these all lead to a great sense of fulfillment and essentially well-being in the person. And of course, there are constitutional factors. Some people, unfortunately, they're always going to be somewhat prone to headaches or digestive problems. That may unfortunately be the path of their health in life. It's a question of. Actually, I was rather struck in your website. You talked there about resilience. You used the word resilience, which is a word that I'm inclined to use quite often as well. I think part of the goal of treatment really is very often is to enhance the patient's both emotional resilience and resilience against whatever health problems they may have or whatever health predispositions that they may have. So I think that notion of being strong in oneself, being emotionally resilient and resilient in terms of one's health, I think these are what one needs to, as much as one can, achieve, and whatever path that may take. People take different paths to try and achieve that. But I think acupuncture and Chinese medicine in general, I think, is a very powerful system of medicine for helping to bring that about.
You touched briefly there, Peter, on the idea or the concept of constitutional health. And I wonder if you could share with our listeners a little bit more about that as it stands in Chinese medicine, as I believe it's a somewhat major concept.
It is a major concept. There's a chapter in one of the great Chinese medicine classics that talks about people having constitutional predispositions. And obviously one sees, especially when one sometimes treats various members of a family, that migraines may well run in a certain family, or digestive problems run in a certain family, or the tendency towards depression and anxiety may run in a certain family. That may, of course, be shaped partly not so much by the person's nature as it were as by the person's nurture. Obviously, if one's brought up and both one's parents are very anxious, a feeling of anxiety may permeate the family home, and that may well influence the person as they grow up. But the notion that we have kind of genetic or constitutional predispositions is a very strong concept in Chinese medicine. And from my point of view, see, I practice two styles of acupuncture. One style of acupuncture, which is called TCM, which is what the Chinese government has kind of codified and decided is traditional Chinese medicine. And it's a fine system of Chinese medicine, but it was put together by committees really in the 50s, 60s, and 70s. And so certain styles of Chinese medicine, certain styles of acupuncture have not become part of what's now called TCM, which is that form of Chinese medicine that has become the main worldwide style. But the style of practice of diagnosing people's constitutional imbalances and seeing what their predisposition is, both in terms of their physical and psychological health, is also a very ancient concept in Chinese medicine. It's probably slightly stronger in Japan and Korea than it is in China itself.
Is that aspect something that was emphasized by your teacher Worsley? I know he's a famous practitioner and had a very particular orientation towards treatment.
Yes, that was his particular speciality, really. And I first learned with him. And for the first 11, 12 years of my working life, I was practicing purely that constitutional style of acupuncture. But it's a great style of acupuncture and remains my first love. But it does have certain weaknesses, I think. It's not very strong with the treatment of infections and some acute complaints, and not very strong in the treatment of musculoskeletal conditions. So I and many of my colleagues also studied what's called TCM in order to compensate for those particular weaknesses in that style. But when I take on a patient, if I take on a patient who's just purely got some sports injury, then that's another matter altogether. But in general, for patients who come to me with chronic problems, then I'm always very focused on diagnosing their constitutional imbalance, which is diagnosed purely by signs, by the sound of the voice, color on the face, the odor, though I'm not very good at odor personally, and the nature of their emotional disposition.
How much is it that you can actually change someone's constitution? Is it malleable, or is it preset and can only be shifted so much in a person's lifetime?
More the latter than the former, really. No, people, once the constitutional imbalance, which is either genetic, really, or certainly possibly laid down in utero or very early in childhood, that doesn't really change through the person's life, although other issues may become much more foreground at certain periods in a person's life. So that constitutional predisposition never really changes. I think the goal of the practitioner is to strengthen that particular aspect, so to make it much less of an issue for the person than it would be otherwise. But certain people, patients sometimes say to me, well, you know what it's like when you get a headache? To which I say, well, no, I don't actually. I've never had a headache. Whereas for many people, they and other members of their family, headaches stalk their life, really. So that may always be an issue for them. They may always be a bit prone to headaches if they get very stressed or distressed or drink too much red wine or whatever it may be. Whereas other people, they're never going to have a headache in their life. And so I think people do have those kind of predispositions towards certain complaints. And it's a question of ameliorating that. But sometimes you can't always completely, obliterate that.
We like to ask people, Peter, about their experience as a practitioner, if there was any particular clients or case studies or examples of working with someone that were fundamentally life-changing for them as practitioner or career-changing? If anybody or anything stands out as being a particular powerful moment in their journey as a practitioner.
It may sound a bit crass to say this, but I've seen so many patients change through the course of the treatment that I'm pushed to particularly stipulate one particular one, although actually one did just jump to my mind, so I'll talk about her, but I could have talked about many. There's a woman I saw some years ago who came to me with what the doctor had diagnosed as ME, or chronic fatigue syndrome. And she was adopted and had a very happy adopted family, actually, a much happier adopted family than many adopted people I've seen would have had. But she always wanted to meet her blood parents. And she, in the end, made contact with her blood father, who was a musician in New York. And she went over to see him. And they got on fantastically well. He was very pleased to meet her. She was thrilled to meet him, and they got on fantastically well. And she was essentially, she talked about it much like you talk about having a lover, really. She was almost kind of loved up, really. She talked about that era. And she came back to England, then she went back to the States again to meet him again. But this time it didn't go anything like as well. He was much more distant this time. She rather blamed his wife, saying that his wife was jealous of his contact with her, although how true that is, I'm not entirely sure. But she was absolutely devastated by his relative coldness. And she came back to England and basically collapsed, had what in the old days would have been called a nervous breakdown, but people don't seem to have nervous breakdowns anymore. They seem to be rather out of fashion. She basically took to her bed, was diagnosed with ME, or chronic fatigue syndrome, and came to see me for acupuncture. Was working in London, gave up her job in London, I practice in Oxford. She came to stay with her sister, I think it was, in Oxford, and came to me for treatment. I treated her on her function, which is known as the heart protector. I mainly concentrated on that. She was just completely broken-hearted, and had somatized her distress so much so that she could barely get out of bed. And was given a Western medicine diagnosis of chronic fatigue syndrome, or ME. After a few treatments, she just felt miles better, went back to London, went back to work, and felt miles better for that. But I think for some reason she jumped to my mind when you asked that question, but I think she's a good example, really, of someone who had somatized their awful, awful distress and heartbreak that she'd had. But the problem didn't lie in treating chronic fatigue syndrome as though that was some illness that had some familiar pattern. The issue lay with helping to heal her spirit, really, and helping to heal her heart and bring her back to her normal self again.
Thanks, Peter. I'm wondering, does this relate to a very important and powerful statement in your book? And that is that it says, it is in the treatment of longstanding chronic disease that acupuncture has the most to offer the patient in the West. Is this an example of something like that? Somebody with chronic fatigue syndrome, for instance? And could you extrapolate on that very important consideration that it has that to offer at its greatest depth?
I certainly think that's true. You see, if you look at the classics of Chinese medicine, a lot of the focus is upon the treatment of acute illnesses, of fevers, because traditionally in China, people would have, yellow fever and cholera and all sorts of infectious diseases that we no longer have in this country now anyway. But even then, when people have, for example, even very severe COVID or any of the fevers, I can't remember the last time I treated a patient in fever, despite the fact that the classics of Chinese medicine are very focused upon the treatment of fevers at the time. Western medicine has very powerful, for example, antibiotics have saved millions and millions of lives. So Western medicine, I think, is very strong very often in the treatment of acute illnesses. Pain relief in extreme cases, for example, or antibiotics for lots of infections. And although acupuncture and Chinese medicine has ways for treating those problems, I think Western medicine is rightly hailed throughout the world as being very strong in those kind of areas. But Western medicine, I think, if you've got a headache and you take aspirin and it goes away, on one level, that's completely miraculous. But it's no treatment for the condition of having headaches. Western medicine doesn't really have any form of treatment for the condition of having headaches or the condition of having asthma. It has, inhalers, which are fantastic at the treatment of the symptoms of asthma, but it has no real treatment really for the condition of being asthmatic. And I think that Chinese medicine, that's where Chinese medicine's strength lies really, in those kind of areas. Antidepressants may well help some people who suffer from depression and anxiety, but they're not really looking at the underlying causes of why the person's depressed and anxious. And I think that it bringing about the movements in qi brings about far more profound and long-lasting benefits to a patient than taking antidepressants or taking asthma sprays or taking an aspirin, maybe, although they all have their time and place.
Acupuncture is a huge body of knowledge, Peter, and I wonder what you think might be the most often misunderstood element or aspect of it by the general public.
I think most people don't realize how profound it is in terms of psychological benefits, really. I think the treatment of musculoskeletal conditions, yes, I think lots of people have heard that it's strong for that, for bad backs. And I think that, being a qualified acupuncturist myself, physios and osteopaths and people doing short courses in acupuncture I'm not wild about this idea. I'm not saying they never benefit anybody, and as long as they stick to fairly basic acupuncture, treating musculoskeletal conditions, which is fairly conceptually simple acupuncture, really, I'm sure they can help a lot of people. But I think it's led to a misconception, really, about the range of benefits that acupuncture can bring for people. So I think that's somewhat changing over the years as well.
You mentioned that acupuncture is a really effective form of preventative medicine, and this is something I'm really interested in. I'm wondering what's the ideal circumstance? What would be if we could just have any version of healthcare incorporating acupuncture? What would be the ideal integration of that in a person's general health so that it serves as a preventative measure versus something that only is generally gone to when it's already symptom oriented?
I don't want to be too much to proselytize too much, but I think that any individual can really benefit from seeing a well-qualified acupuncture practitioner because I think one of the differences between Western medicine and Chinese medicine is that unless Western medicine can find some pathology, can find something in the bloods or something in the X-ray, then basically you're fine. In Chinese medicine, we're all unhealthy. We've all got some imbalances in the nature of our qi. It's just a question of degree. So I think potentially anybody can benefit really from having acupuncture to minimize those particular imbalances, even if they're not severe enough that they're causing the person significant problems. I think it can still help people, like I say, become more resilient against the health problems that they may well suffer at some point in the future, and also against also what we might loosely call emotional resilience as well. I've been very shocked, really, in recent years, seeing the enormous increase in particularly young people and teenagers, with anxiety and depression, which has become so widespread in more recent times. And that feeling that very often that they do kind of lack that emotional resilience for whatever we may have different views as to why this has become so more widespread now than it was in the past. But it certainly would appear to be the case that many young people don't appear to be as emotionally resilient as they used to be, or they would like to be.
So that really brings things full circle around to the idea of it being holistic medicine, and that it's not about treating symptoms necessarily, but even looking at balance itself, balance in the individual at the level of qi and energy flow, etc. So thank you for that. And that's something that is a different framework for so many people in terms of considering their health, in terms of considering their overall wellness or well-being.
Yes, when I say I see a lot of patients on once at the change of every seasons. Often they'll come in and say, "Well, I can't think of very much to say, really. I feel fine, really. Now, sometimes in that situation, I may not treat at all. I think there's times to treat and times to leave well alone. But quite often in that situation, I'll still take their pulses and look at them and maybe do some treatment on their constitutional imbalance, just to keep up that resilience, really, and to try and maintain that state of health."
We mentioned the College of Integrated Chinese Medicine in Reading at the beginning, where you're dean, and I'd like to also say this, we believe, is the largest acupuncture college in Europe. Is that correct?
As far as I know, yes.
And you're also a senior lecturer and clinical supervisor there. Could you tell us a little bit, and our listeners, Peter, about the offerings there in terms of courses and trainings, etc., for those who may be interested?
Well, it's a university degree. It's a BSc honours course, so people can get student loans to cover the vast bulk of the fees. There's only 2 colleges in the country that offer university degrees. We're trying to grow the profession in this country. I think that, and coming to that kind of level will help to give it more credibility, as opposed to people doing just short courses. And the college in Reading, we integrate these 2 styles, of the 5-element constitutional style, which I think its real strength lies in bringing about a change, a more holistic style, and bringing about a change in the nature of the person's chi at a deep level, and also TCM, which I think is a stronger style in terms of particular symptoms. Why does this particular person have very heavy periods? This person has very light periods. Painting there's something different about those two different people, and I think TCM is very good at understanding why it might be different in that kind of way. And so we think that integration of these 2 styles, that the kind of strengths of one style rather complement the weaknesses of the other style, really. So by an integration of these 2 styles, we hope that our graduates are both equipped to cope with if a person walks in with, they've just hurt their back, and they're good at treating bad backs, if that's what's happening, but also they're also adept at treating people on a much deeper level and treating them for their chronic illness and their psychological issues, or the fact that their psychological issues are intricately interwoven with their physical problems.
Quick question. What do you think is the best thing for people's chi? If you had one piece of advice for saying keep the chi flowing, vibrant, alive, etc., what's the best piece of advice you could give somebody?
I think, as I said earlier, really, I think happiness and fulfillment. I think that's really the best we can do. I think lots of different paths to how you make that happen. But I think feeling dissatisfied either in one's working life or in one's loving relationships, or a lack of contentment with one's own internal voices, one's own maybe self-critical sides. I think learning to become more accepting of oneself, creating loving relationships and fulfilling work. I think those are a good chunk of what we all need, I think, in order to create better health for ourselves.
Are there any stones unturned for you, Peter, as a practitioner, as a professional? Are there any next moves, career-wise, or ambitions for the future?
Oh, there are always stones unturned. If you practice medicine, you'd be a fool if you ever thought that you had nothing else to learn in that kind of way. I'm rather excited at the moment because my particular interest is the 5-element constitutional style and people's emotional worlds. That's my particular interest. I'm just currently putting together a series of lectures for a course on that, or something called the TCM Academy, which is an online, because these days much teaching course goes on online. And see, if you're a practitioner, there's a limited number of patients you can really help in your own lifetime. So I've been a teacher of acupuncture, and I've taught, I don't know how many, but so 1,000 or 2,000 students who then go out to help other people as well. But the notion now I might be able to reach out beyond, Southeast England, and maybe practitioners in any part of the world could do the course and get a sense of how I think acupuncture could best be practiced. Whereas very often many of them have just trained in rather more mechanistic TCM styles, somewhat more symptom-focused styles. So I've now got an opportunity to try and leave some legacy behind for a worldwide market, along with the textbook that I co-wrote. And that's quite an exciting idea for me at this stage of my life, really.
Thank you so much for joining us today. We really appreciate you sharing all of this important information for our viewers and ourselves around acupuncture, its effects, and also sharing yourself and your story and your wisdom.
It's been a pleasure. It's been a real pleasure. Thank you very much.
Thank you very much, Peter.
Thanks for listening to the episode. What really supports the podcast is providing a rating and review of the show on your preferred listening platform. This helps us get the message out to a wider audience. If the topics we discussed today appeal to you, do take a moment to subscribe. Lastly, we invite you to check out our website, fielddynamicshealing.com, to learn about our training programs, private session work, and to see how we're setting the standard in contemporary energy healing. Many thanks, and see you next time.